friendly neighborhood PhD, and you're listening to the TyePod. Well, hey everybody who is used to listening to the TyePod, where I am the host asking the questions. And we're trying a little experiment today. I'm actually going to take a little bit of a opposite approach, and I will be answering a few questions from Shaniece, who is a nurse who has experience with front lines of COVID and also with maternity and IVF clinics. So she is coming to the show as someone from the perspective of the healthcare area. So yeah, it's going to be interesting to flip roles a little bit.
Absolutely. Thank you for having me again. I feel honored to do this and just do the switch here. And so we can kind of all get to know a little bit more about you and learn new things probably. So I'll call it the Thai podcast. I should be like, welcome to the Shaniece podcast, but
Hey,
we
there you
won't.
go. You can just come up with your own title there.
Exactly, right? No.
The Shaniece
But
Show.
oh, absolutely. I was thinking, since you always kind of start with an icebreaker with like a music, I think we should do an icebreaker. And the last time you had me over, we were just talking about Taylor Swift, of course.
Mhm.
So I'm thinking maybe I should ask you, what is the one Taylor Swift song that you relate to the most
Eesh.
right now? Like,
Right now. Okay, that's an interesting
hmm,
question.
I know
Hmm.
there's a lot of songs to choose from.
There are a lot of songs to choose from. I mean, there's like obviously the big like singles that are out now from the newest Life of a Showgirl album. Um,
Yeah,
you know what though? The Opalite song just kind of sticks because I feel like it's kind of,
yeah.
you know, almost going that positivity route where it's not, I mean, it's not like, I don't like to talk about fake positivity or like toxic positivity, but it seems to kind of have kind of a lighter note and like taking something darker maybe and turning it into something, you know, better. I don't know. That's kind of the one that comes to mind.
Yeah, 100%. I would agree with that song. I think it's like a really uplifting song. And it is a little bit of a bop, but I agree to it. There's a little bit more like a message to it if you really look into it.
Yeah, yeah,
But
and I know that in the past, yeah, we were talking about like the heavier ones, and sometimes those resonate more. But this one's a little bit different. Maybe it's like a hybrid.
yeah, it is. I think it's just like a few of those songs. Because I was gonna say the one that I relate to the most lately is from her Tortured Poets Department, which is very sad, but it's the song I Can Do It With a Broken Heart, which is a little
Mm-hmm.
bit more upbeat.
Hmm.
Kind of a good mix there.
Yeah, exactly. And I know with the COVID thing, I mean, I think there was some inspiration for that in the folklore album too, obviously. But like songs like, was it Ricochet? I think there was one that was like from the perspective of somebody, like passing or dying in like a medical setting almost or something. I don't know if it was Ricochet or if it was another
Yeah,
song.
no, My Tears of Ricochet is a lovely song, but that one's Epiphany.
Yes,
Yeah,
yeah, that's right. Yeah,
yeah,
I always
that's a
get
really
those
cool song.
switched.
Yeah, no, that one's a really cool song. She actually, I think she wrote that dedicated, I think, to her grandfather, if I'm not mistaken, for him being in the army. And then
Oh,
she
okay.
flipped in the other verse and talked about being a frontline worker in the COVID days. So that was
Yep.
really a really good song in COVID days for me to listen to. Like, I don't think I listened to that song without crying for the first 6 months of like
Mm.
listening to it. It brought a lot of emotions and like memories back from the COVID unit.
Does that feel like a new
Absolutely.
thing
Yeah.
for
She's
her, or do you think does it feel like she's always tried to do that with songs?
with what, sorry?
Like, does she always has she always tried to have some songs like that, or is it you feel like it's a new thing?
I want to say it's like a newer thing. I wonder if
Yeah.
she might have dedicated that maybe at that time too, just because it was such a big moment in everyone's life. We were all isolated. We were all kind of dealing with the same thing, but in a different way. So I thought it like was really cool that she was able to bring that to light and describe things and just the way that she used her lyrics to explain things. It blew my mind because I felt like I could relate to it so much as a healthcare worker. And she was never in the front lines, you know what I mean? So
Yeah.
yeah, it was a really interesting song and like an interesting album just with all these different stories she kind of talked about.
Hmm. Hmm. Totally
Hmm.
agree.
Absolutely. But enough of Taylor Swift. As nice as it would be to talk about her, I was just thinking COVID days and stuff like that. Be really interesting to kind of hear a bit more about your own story. I know there's quite a bit that happened to you in those times, but I was thinking, why don't we kind of take a journey back on a timeline a little bit and just kind of go back to like when you were maybe closer to like 7 or 10 years old
Mhm.
around then and kind of just like explain where you were at in life and kind of yeah start from there maybe.
Yeah, that sounds good. There's definitely a long history there. I mean, like my own version of eras, probably, if you want to look at it that way. But yeah, like starting out, I was able to, kind of do a lot of the regular things as far as walking and physical things. And for those who don't know, I do have muscular dystrophy, and so it's a progressive muscle disease that, gradually you lose a lot of your I guess bigger muscle function, and then it focuses more on kind of the fine motor stuff, and it's just a gradual, you know, process. And for a lot of people, it progresses different speeds and everything. So mine actually did get diagnosed when I was around 10. And they thought it was Duchenne was the type. And honestly, that wasn't confirmed until a year ago. So this was a long time ago that they thought it was that, but it took a while to fully confirm it for some reason.
Oh,
Yeah, but yeah, it was just gradually noticing some, lack of strength in sports and like PE class and things. And that's kind of where I actually had a fracture in my ankle, and that kind of started maybe accelerating things a little bit because I did have to use manual wheelchair as I was recovering. And so that was a little bit, it seemed like that recovery took forever. Um,
yeah.
yeah, and honestly, like throughout my whole timeline, up until about 5 years ago, I actively tried to avoid anything medical, like even a basic checkup. Like I didn't want to go do like a heart checkup that they recommended for people with muscular dystrophy, and so like that, it's interesting kind of thinking back on that, how um, I almost tried to downplay using the wheelchair and having muscular dystrophy. And that's really weird to say because, I'm sure someone listening that hasn't had it is like, it's the most obvious thing in the world physically.
Yeah.
But yeah, it's an interesting, as I'm growing up with it, right? Like it's not like it happened just all of a sudden
No.
midlife, but it's gradually been like new versions of me and sort of coming to terms with what that looks like, and how the outside world interacts with you when you have that kind of thing going on.
Oh, absolutely. Like I can only imagine not only what you're having to internalize and all that, but just having the whole perspective of the outlook of how the world might view you, just because it's a big change. And unfortunately, we live in a world like this.
Yeah.
Um, and so, yeah, like just out of curiosity, I guess, just from being a nurse and helping like rehab, like just helping to rehab people,
Mm.
and even like in a younger crowd with kids and stuff like that. Like, if you don't mind me asking, how were you feeling? Do you kind of recall those feelings you were having when you were quite younger and you were, I don't know, progressively, like you're saying in PE, kind of noticing a little bit of weakness and maybe noticing a few changes compared to other people around you?
Hmm.
Like, how did you
Hmm.
feel?
It,
Yeah.
I mean, everything tends to leave people with disabilities behind, and as I got older, things like football and homecoming and prom, like all those things became harder. But starting out very early, it was almost like other students and kids noticed. And maybe I was just sort of, for whatever reason, I had blinders, or I was trying to be oblivious to it, or it seems like I had two or three friends that were really good about, they would stay back in the classroom if I couldn't go to recess or something, and they would kind of hang out and try to make it less isolating. But at the same time, you're always looking at those things, and you can't help but compare to other people. And honestly, we're conditioned, I think, very well in society to compare to somebody else and always be trying to like wishing you could maybe be them or do what they can do. And,
Yeah.
so I think part of me as a younger kid, I tried to almost ignore a lot of it. And that has its own pros and cons, like there's, I think, many things that trigger probably, and honestly, internal ableism, things like that. I think they take a lot longer to get through. Um, but yeah, it was kind of, I mean, it was a challenge, seeing other kids doing things and growing up, and feeling kind of left in the dust, so to speak.
Yeah, absolutely. That'd be quite the journey to have to kind of overcome, I think. And
Mhm.
you'd have to be quite resilient and have a very strong mindset to continue on and have like a positive outlook. I know, like,
Mhm.
obviously it's not relatable to my own experiences, but just experience wise, when we go through tough things, I find like you really have to have a positive mindset on things like that.
Mhm.
But yeah, sorry to hear that that was your experience in the.
Yeah, yeah, and I mean, I think there was a lot of times I did feel a little bit sorry, but overall, I think I did a good job of maintaining enough positivity. Maybe probably too much actually for a long time. Now I like to look at it a little more. like pragmatically and be like, there is positivity and you can try to, you know, find a fulfilling pathway, but at the same time, you don't have to pretend that everything is fine all the time. That it's okay to talk about it because honestly, like even people that don't have disability yet, I mean,
Mhm.
they're either going through something else traumatic or hard, or they will at some point, or they know somebody who is. And so when you kind of think of it that way, it's like, well, there's that human side that all of us are going to be dealing with some kind of hard times.
Absolutely.
Yeah.
Absolutely. And like it's a good way and an outlook of looking at it as like you might be someone that's has a disability and not everyone in the world does, but we're all somewhat affected by it. Some have
Mhm.
brothers, sons, etc., who do live with a disability, good friends and such. So I feel like a lot of people I'm happy to see that there's still like that humanity like perspective on things where people are still there to support each other,
Mhm.
want to make sure that you feel supported, I'm hoping, and like that you're able to have more of a positive outlook and be
Yeah.
able to, take different opportunities, take risks and such, just regarding those circumstances.
Yeah, the risk thing is that's an interesting one. Like there's I think a lot of people are a little bit more brave or like ambitious or take maybe bigger risks than I do when they have disability, right? Like there's always that like I think of some people doing skydiving or trying to do Everest or things like that. And I'm just like, you know, it doesn't take that level of, you know, taking risks or being aggressive. Like you can still
Not at
do
all.
that in
You
a
can
lot of
have
ways.
risks
Yeah.
like starting a podcast and see how it
True.
goes. It doesn't have to be skydiving or I would never do skydiving myself, just for the record.
Yeah, yeah, I know. And that, like that doesn't mean you have to start doing those things, once you have a diagnosis or something. But I was even thinking like from nursing and healthcare, like you see a lot of people that have disabilities of different types, and like I mean, you see the impact on, and like in the end, they all have human sides too.
Yeah.
So I feel like you kind of have a unique perspective there too. Like you get to see a lot of maybe it's not long-term disability, but it's chronic illness or,
Yeah.
other things going on.
Absolutely. Like I said, I usually if they're in the hospital, like on a medical unit and such, we're just treating acutely. So just
Hmm.
what the problem is now. So we see obviously all sorts of people that come with shorter issues, like, a broken bones, they need rehab, a little bit like that. But like we also have people that stay who have chronic illnesses, and it could be
Hmm.
anything that stems from like muscular dystrophy to, you know, just chronic GI issues and stuff like that, like Crohn's disease, all those flare ups when they come in and such, or colitis. And I do feel like as a nurse, the more that I work in a healthcare, the more that a lot of the pain and the things that the chronic patients have doesn't always get validated or
Mm.
taken as seriously, I suppose. I feel like sometimes I feel like we need a new outlook on just how we treat patients that way, just because I feel like we should have a lot more empathy and respect and have a little bit more understanding of where you're coming from. I feel like
Hmm.
pain's very subjective. And that's like a big one where I have a lot of discussions with patients that have chronic issues. And when I actually sit down and hear them out because they're frustrated with their care, it's just because no one is taking them seriously with their medications. They're being judged for biases from other things that they shouldn't even be judged about. Like, I don't even want to use the word, but like, kind of like drug seeking and stuff like that, which is not
Oh, yeah.
at all, and such. So I don't know. I've seen a lot of different behavior, people treating people different ways. And so it's very unfortunate to see. And I know it's not something that like I could fix myself. No one can fix the healthcare, but like
Yeah.
all you can do is at least be that nurse on that shift that can sit there and at least listen and make your patient feel validated
Hmm.
and heard, because pain is real and like we just want to validate that too. And
Yeah.
yeah, that's kind of like the difference that I've seen from like people that are there chronically and they seem to know a little bit more of their health as well. So I work alongside with them because they know what works for them and what doesn't. And when you work as a team, it's just so much easier. But there's some nurses I want to say that I've seen in the past where they don't want to collaborate with you. They just want to do their way or the highway, and they
Hmm.
sometimes you get into those frustrating um, topics when you try and like communicate with a patient. I think a lot of it has to do with like communication issues and factors, as well as yeah, just having enough time, I guess, as a nurse, because we don't always have the time to sit there and really
True.
talk about these things. But yeah, I have definitely seen an impact on that in the healthcare for sure.
Yeah, that's interesting. You mentioned the pain management side because like
Mm.
again, I hadn't really gone there. The only thing I had taken really as a kid was prednisone to try to maintain muscle strength, and that went horribly. I mean, there were so many negatives. But thinking back
Yeah.
on more recently, I've had to do more pain management. Like some settings with some doctors, you feel. I mean, I almost felt like I was getting screened as an addict or something, and they're wanting continuous monthly tests, and I was like, dude, I don't have any past history or
Yeah.
like I'm trying to manage, obviously something that's consistently going to be causing
Mm.
issues, and it's weird to see so many in the medical side, nurses or doctors that they treat patients that like they don't know anything about their condition or what they need, and I just feel like that's such like a source of conflict, and really it's a hard thing to deal with,
I
um,
would agree. And I would say
yeah.
because the experience and the outcome on the patient's perspective of things, if that's the case, I feel like that doesn't really push for you guys to ever come when you really need the help. Like you said, just kind of delaying care and such with time, because
Hmm.
I'm sure there's been a lot of people that have dealt with not only the traumatic scenarios, but just not feeling heard, I would
Yeah.
say, probably.
Oh,
Hmm.
absolutely. Yeah, like and I know that people grow up thinking maybe the doctors are the expert, but more and more, and as we experience things, it's like, no, it's what you're saying. It's a care team, and
Yeah.
it's the best way to do that and make patients feel safe to come to a medical setting. I mean, like it's so needed and it's not happening enough, and I see it occasionally. But
Yeah.
but I think it's in like from talking with you and like the nurses that do understand and have that empathy factor. Like I feel like they're eventually, hopefully, that would break down some of the barriers going on. But it's too persistent still, honestly.
I would agree. I think that at least a step forward is just talking about things. And like, this is great to kind of just have a healthcare worker and a patient because
Yeah,
we don't have the time in the hospital to have these conversations. You know the
and
deal.
it's a
And
stressful environment.
absolutely. And it's not the place to do so, right? Because we're just focusing on you essentially, or whoever else in general who is
Hmm.
coming in and needing to be attended to with like other things at that point. But definitely something that we still need to talk about and just gain perspectives, because I always find that if you're open-minded and you're willing to listen and learn and gain new perspective, it really does open the door for opportunities, maybe hopefully in the future where we see a little less of that in the healthcare world. But
Hmm. Hmm.
definitely a challenge still. Absolutely. It's very unfortunate. And I'm hoping that we build up since COVID, because I do think that COVID, um, at least in Canada, put
Hmm.
a little bit of a halt on the healthcare. It's definitely changed a lot of things, and we still have a lot of work to do. And we
Yeah.
definitely still short staff, unfortunately, in all those issues too, which I think kind of all falls in for all this big issue, if you will. Like it's just
Yeah.
if
Yeah.
there's no time to attend to our patients, then there's no time to have these conversations that should be had at the
And there's
hospital where we
no,
should
I
all be
mean,
collaborating.
yeah,
Hmm.
there's no end in sight really to it, I don't think, because COVID, to me, it created so many new issues and pushed things back, and then obviously it was like,
Yeah.
I don't know, administration that fights against change as well. It's a hard space to navigate everywhere within healthcare, for
Oh,
sure.
absolutely.
Yeah.
Yeah. And like you were saying, COVID just being an extra challenge or an extra obstacle into that healthcare world. But I thought maybe we could kind of talk a bit about that timeline of your
Hmm.
life, because I feel like that was a pretty big one for you
It
to have to.
was,
Yeah.
yeah, yeah. And it was one of those things that I was even more worried or scared to have anything to do with the medical, areas of the disability and like pushing the appointments back and not wanting to do routine, I mean, even dental stuff or eye checks, like everything took a back seat even more
Yeah.
than before. So yeah, when COVID happens, the isolation factor and just like not knowing what to expect, I was checking infection rates, every day and I don't know, it was and being in like I was in New Mexico in a rural area, and so it took quite a lot longer for the infection to spread, to our area. So it felt like something out of a movie or whatever, just kind of waiting, like when is it
Yeah.
going to strike? And yeah, and what I think kind of started a lot of the issues is I did lose my grandfather kind of right away into that. And so that was
I'm
a
that.
big
Yeah.
thing. Yeah.
Hmm.
And then yeah, being at home, like it's interesting. My work at the graduate school I was in, I just actually got my PhD the summer before, and I was starting a new position as a postdoc researcher. And so I was trying to shift. Like I had always been a hybrid worker and work some at home, but now it was obviously 24/7 at home. And so it's interesting. I
Yeah.
felt kind of the pressure to like my productivity needed to be even higher because all of a sudden I was like it was more accessible, right? Like because everyone was working at home. And so it was like, oh, I need to step up, you know, all the different work related things I was doing. And that looking back, that was not the best decision to think that. Yeah, and it was just like that next year was just crazy in terms of the pressure and the burnout that I already had issues with, and it just pushed
Yeah.
it to the extreme. And so, what kind of started the whole cascade of hospital stuff was I had a gallbladder infection that later I found it out it was either septic or right at septic. And so that basically resulted in me one morning my pulse was like super low. Yeah, we have a visitor. And the oxygen was super low. And so I ended up having an ambulance come over, and the minute they put me on the oxygen tank, I basically blanked. Like I don't remember anything in between being taken to the hospital or anything. And I woke up and I wasn't able to talk. I'd been intubated and had a tube, running down through my mouth and throat. And so like talking was gone, obviously. And yeah, it was just a state of total confusion. And when you have muscular dystrophy, like the things that are independent that you can do are so valuable. And so like talking and communicating got taken away um, right
Yeah.
away. Yeah. And that was like one of the things. And now I'm looking back like, well, that should almost be in every medical protocol. It's like, well, if you can't talk, then can you see if the patient can write or something,
Yeah.
Yeah, because it was like a prison basically. And it
Or kind
took
of like a mental prison where you're there, but you can't say or speak your
exactly.
mind or request what you need. Yeah, that's absolutely tricky. And I've worked with patients where there's been communication issues in so many ways, and yeah, it's quite a challenge. But a protocol like that, especially if you have a history where, yeah, absolutely, just kind of having that in a protocol where it doesn't get missed could just kind of help with avoiding people slipping through the cracks and dealing with things
Yeah.
like that.
Yeah,
Yeah,
and
kind
like
of
I mean even things like when they would do any kind of hygiene activity or if I had to get on my side, like I honestly I hadn't laid on my side or my stomach in probably 20 plus years when I went in the hospital. And with MD, um, there's these muscle contractures where you can't straighten out your joints. And
yeah,
so, at first it was just brute force nurses, trying to turn me on my side. And it was just like it's like, do you know like when you have a nightmare and you try to scream out, but like the scream
yeah,
doesn't reach
yeah,
anybody? It was
yeah.
like that. Yeah.
Oh
And it
gosh.
was, like I had always had my own protocols on this is how I transfer and this is how I have caregivers move me,
Yeah.
and not having that was just really hard to take.
No,
But yeah,
absolutely.
gradually it happened, like and there were honestly there were some nurses that were pretty life-saving that came in, and I mean they would visit, like they would actually talk and make an attempt to, you know,
Yeah.
to chat even like a small amount. And once they did that, and one of the nurses actually noticed like I was moving my hand like I wanted to write. And
Yeah.
all of a sudden she said, "You want to write?" And I was like, "Yeah." And like that, I think that
That's
was
what
the
did it,
turning
hey?
point.
Yeah.
Yeah, like I could start saying things to my parents, to the nurses, and um,
Yeah.
gradually that helped so much.
Oh, yeah. I can't imagine that probably just turned it around for you almost, where you're like,
Mhm.
okay, this is how I've been feeling, that these are the needs I'm needing. Like,
Yeah.
yeah, yeah, jeez.
Yeah. And there were some that were still wanting to do brute force, you know, it was like no, we're just gonna do it. And I was like, that doesn't work. So,
No,
you know,
absolutely.
that communication factor was just everything, despite I mean, my writing wasn't that great, and I had to have a lot of help actually even holding my wrist up to position. But again, like we have stacks and stacks of papers where I just had these random notes like scribbling, and I don't know, it's kind
Right.
of interesting to look back on that. But yeah, I made the decision to do a tracheostomy, you know, while I was there. Um, and that being able to talk again obviously was a big deal. And I thought in my mind, I was like, well, I can maybe get off the ventilator at some point, which I haven't yet, but it's not even something I think about it now, but it's not something that's high priority if I can still do a lot of the things that I
Yeah.
want to. And that honestly, it took so long to be able to eat and drink and talk and drive my wheelchair again. You know, like I regained all of those skills, at least
I believe
close
it.
to
Like,
what it,
yeah.
yeah.
Yeah, like as a nurse too, I feel like just helping people with rehab, like taking them to rehab, getting them ready enough to just be stable enough medically to go to rehab. And then you
Mhm.
send them off and you talk to them, and it's like they're in there for 6 months to a year, sometimes even longer than that, sometimes for life. Like people don't understand sometimes how long of a process that is. I
Yeah.
totally can imagine that took a long time to just turn back around and kind of go back to what your baseline was.
Mhm.
Yeah,
And to be honest, like that's still I'm still not there, but it was
yeah.
to a point where I could go home at least. And you know that was I mean, getting out of prison for sure is how that felt leaving and you know
Yeah, yeah.
and like
How long was your hospital stay then, like in the COVID
yeah.
time?
So I think I was there I want to say like right out of a month because I went in early December and spent, you know, the holidays in ICU, which was that was interesting.
It was
And
probably an
then
experience.
it was, yeah, yeah. And yeah, I stayed through. I think I got home January, I think it was 19th of
Wow.
2022. Um, you know, and that was like I couldn't drive my chair. I was taken home in an ambulance, you know, and like I was bedbound once I got home for, you know, quite a while. And it was we brought in therapists, you know, like OTs and PTs to work with. And you know, one of the interesting things too was like I one day I was getting my hand and arm stretched and like I think it was cartilage in my thumb joint like popped and like I tell you I screamed probably as loud as I ever have and so it was just like that kind of stuff had happened even before like overextending joints, you know, and now it was like throw that on top of, you know, recovering from the gallbladder and the ventilator and tracheostomy and all that stuff. So it was, you know, it was a
When it
challenge.
rains, it pours, it seems like, hey.
Yeah, yeah, it
Yeah,
does. Yeah, and I remember I couldn't get insurance to cover travel back to do some follow-up appointments,
right.
and I remember my mom who was helping me, you know, with recovery and stuff. Like she somehow worked it where I had 3 appointments. It was like a swallow test to see if I could eat and drink again,
Yeah,
and it was like a speech test to see how the speech valve was doing so I could communicate, and it was like $2,000 for the ambulance ride, like there and back to do 3 appointments because I couldn't sit upright to get in my van.
great.
And
So
so
you
like
needed
I
to run
was
faster, hey?
exactly, yeah. Or like with my current wheelchair, like I could flatten it, you know, make it where I was laying backward, but it was it was a challenge,
That's
you know. Yeah.
challenge not only like mentally and what you're dealing with, but like that's a lot of stress financially. Like again,
Mm.
I'm from Canada. I keep forgetting that the healthcares are a little bit different here. So like that's crazy to think that you'd have to think of all that on top of things.
Yeah, it was crazy. Yeah. Yeah, and I don't it seems like there should be a better way to get transport that way, but yeah,
Absolutely. I
still.
don't think that people should be paying just because they can't make it work in a regular vehicle just to get to appointments like that. I know it's
Yeah.
frustrating.
Yeah,
Really.
it was, but I remember that first day though going into those appointments and like they were seeing if I could drink, you know, like
Yeah.
water or apple juice or eat like something like pudding or whatever. And I was
Mhm.
just like, you know, when you have gone without eating and drinking for a while,
Yeah.
like that was a good feeling being able to, taste things like that again. And
Yeah.
yeah, it was kind of funny too, like my sense of smell instead of being through my nose now, it's actually where my tracheostomy is. And so
Really?
it's the strangest thing. Like I cannot pick up smells if you hold something to my nose. But if you hold it like to my ventilator or even like if you detach the hose from the trach and put it there, like I can then I detect smell. That's one of like
Interesting.
the
Huh.
weirdest things. But
I was gonna say, I don't think I've heard that one as a nurse before, so that's
it's
interesting. Yeah.
yeah, it's the strangest thing. And even like when I blow my nose or something, like it seems like it all collects
Yeah.
there instead of in my sinuses even or something. But it's random.
Interesting.
Um, yeah,
Yeah,
but
definitely
it's
an adjustment nevertheless. Like I wonder,
yeah.
how did you feel when you found that out that you could smell stuff through the ventilator?
I mean, it's weird because I miss like I always had a really strong sense of smell with my nose, and like to lose
Right.
that
Okay.
was it was weird. And then all of a sudden I start picking it up like during these random times like where we're doing maintenance on my trach maybe or something, and it was just like, oh, okay, this is like I'm glad I have it. I mean, I'm able to do those
Yeah.
things again. Like even taste, like it's all just so it's all so interconnected and complicated. So it was an adjustment. But that was one of the more fun ones, on top of all the other, you know,
Yeah.
trauma that was happening.
Absolutely. Yeah. You got to honestly look at the little wins sometimes. That's what I tell my patients. You
Yeah,
don't look at the big picture. You look at the little wins along the way, and then
yeah.
you look at the big picture after, right?
Exactly,
Yeah.
exactly. And you were mentioning too, like as far as like the financial burden too, like I had to stop working, basically and apply for disability benefits and things like that. That's a whole other list of struggles in a way, to try to make ends meet there.
Yeah, absolutely. Yeah,
Yeah.
I'm not sure how it is in like the state that you're living in or anything, but it'd be interesting to know how much support there is for certain things that way, especially on the financial side of things,
Yeah.
because let's be realistic here. We live in a pretty expensive world, you know what I mean? And it's
It's
not going
getting
to get
worse too.
cheaper either. So it's, yeah, that's crazy to
I
think
don't
on
know
top of
about
that.
you, but were there groceries that were like in short supply there? Like anything that was like really limited as far as like things at the grocery store?
Okay. I think it was worldwide, but like I think everyone lost their minds and just went for the toilet paper. It had nothing to do with the
Seriously.
food. It took me, I think, three grocery stores to find toilet paper one day, and I was like, I'm gonna give up and just
Exactly.
buy Kleenexes at this point.
I mean, like, let's
As
go outside and get leaves or something. It was just getting like,
long as it's not
why?
poison ivy, you're there.
And I live in a state
Yeah,
where that is now. So yeah, that's yeah, valid. But yeah,
yeah,
it was toilet paper. It was like the antibacterial wipes. Like that was a thing. And
yeah. All
yeah.
that stuff too. We in the hospitals we had some like pretty high powered hand sanitizer because
Mm,
we ran like we were running out, and like I will never forget how horrible that stuff smelled. You would put it on your hands and it smelled
mhm.
like a bad hangover is the best way of putting
Really?
it.
Oh wow.
No one liked the smell of the hand sanitizer during
Like
COVID
I'm gonna go
days.
like soak my hands in some vodka or something.
Literally, or like
Yeah.
tequila was the best way of explaining it. Some
Mm,
of the
hmm.
coworkers were talking about it, but it was not, yeah, it was not fun to use.
Yeah, and the masking too. I don't know if that was the thing for you all, if there was a shortage or not, but yeah.
Oh, yeah, actually, I heard more in the States that it was at one point. In my hospital, in my experience, we never ran out of masks or had any shortages like that, so
Hmm.
we were quite fortunate.
Yeah,
Yeah.
yeah. And now I don't know about you, but like it seems like in recent years now it's things like eggs in the grocery store are like super expensive or I don't know, it's the most random things nowadays that
I know. I'm like eggs, butter, milk, all the
like
baking ingredients I need for cookies.
I mean
It's so
like that's essential stuff. Like we can't be
absolutely.
losing
How much
cookies.
baking I do. Yeah.
Yeah.
No, it's yeah, it's absolutely we already live in a crazy world, I find, and so it's I'm sure a lot of stuff to like handle. You had to like multitask in different ways to like deal with stresses, right? Because I feel like stresses don't always just come in one; they always come in like
And
multiple forms all at
and they
once.
don't always go away, right?
No, no, absolutely. Like I feel like some stick with us and then some kind of shape who we are as an individual sometimes with how we view things, right? So
Mm, hmm.
absolutely.
Yeah.
Do you ever find that to be a struggle for yourself?
You mean as
throughout all
far as
this? Like
like,
just finding like the mental strength to
mm,
power through things. Like how did you cope
oof,
with all that?
yeah, that's a
Or
hard
what are
one.
some ways that you coped? Because I feel like that would be a long process, and maybe with time you found different coping mechanisms, right?
Yeah, yeah. And I think, back when I was younger, first dealing with all of the diagnosis stuff, like I did kind of have that, toxic positivity thing and almost just like
Yeah.
getting to the point where I was like downplaying and pushing some things down, which, like overall it was really great, but there were some little things that needed to be tinkered with, as far as I
Yeah.
think processing and mentally coping, and obviously like once I went into ICU and not being able to talk. Like there was just so much stuff going on there that was dark, and there were thoughts I had partly because of medication, probably, but things like I'm not sure if I was going to go through, going to make it through that. Like, would I want to make it through and be on a ventilator? And so they're like, that was a tricky one. Like without my parents there, like I'm not sure that I would have had the mental strength to keep going. So I think the support system, which even before that was good, but like the closest
Yeah.
supports, became like that's the only way I got through and had the mental capacity to do it, Um, and then recovery, like going back home and then like, finally being able to have control of some things. Like I was back on social media, and back where I could access some of that. And um,
Yeah.
I tried a lot of mental health type like therapist coaches. I got pretty adventurous as far as that goes. And I never even thought about mental health
Yeah.
before, and so I was
Yeah.
experimenting, trying to find things that worked and probably got a little too aggressive on some of it. But I think I
Yeah.
found a good place though, because like the social media, the Instagram community is kind of where I got started on um, finding some people that shared some experience and like maybe didn't have the same disease or even like in your case, being in the healthcare industry, I found
Yeah.
myself really getting a lot of help mentally, seeing other people, struggle and get through some things um, and realize that we can't always just have a fix for
Yeah.
everything. We can't have perfection or a cure or just constant happiness, right? But it was finding like I think little places where there's some enjoyment, some shared experience,
Yeah.
and that ended up being the bigger mental health aid for me was not feeling quite so isolated and
Yeah.
like
Especially
despite
after being isolated for a while.
yeah,
Yeah.
exactly. Yeah. And like the
Yeah.
podcast, like obviously being able to
Yeah.
talk and host that was a big deal. Yeah, so
Absolutely.
that's like the
it,
mental health
it brings
coping.
a sense of community too, right? And like
Mhm.
the more you talk out about things, I feel like the more people are going to hear. And it just, yeah, like you said, they might not be going through the exact same thing you are, but we're all going through certain things and we're all trying to just maneuver through life. And everyone's got different struggles or disabilities or things in their life. And so it's great to see that there is still that sense of community and we're still all like human enough to
Mhm.
make those connections and feel like sometimes your voice is being heard and it is valuable to hear.
Yeah. Yeah.
Yeah.
And I'm not sure it had been heard before. Like I wasn't vocal about sharing my story or using social media for any kind of advocacy or volunteering. And so that's kind of
Right.
become my career in a way, is
Yeah.
that space.
Yeah. So it's like, what would be your goals if you had them, like for your podcast in the
Yeah.
future?
Honestly, I think I mean, disability is like such a spectrum. I mean, it's obviously not just the patient and their caregivers or their families. It's like, it extends so far. Like there's so many diverse areas of healthcare and disability. And it's such a spectrum too, right? Like there's
Yeah.
not a one size fits all sort
Not
of
at all. Like I
treatment or
feel like for you,
strategy.
for example, like muscular dystrophy, you could present your way versus someone else presents completely different,
Yeah.
you
With the
know?
same
Yeah.
diagnosis, right?
Yeah.
Yeah.
Yeah. Yeah. That's what I was kind of getting at.
Yeah, yeah,
Yeah.
yeah. But no, I think
Yeah.
it's, the goal I think to me is to kind of amplify the voices across the whole spectrum because I feel like there's this, I don't know, this idea that these different disabilities have to band together separately. And,
Yeah.
like there's not any sort of cross help or cross talk on a lot of it. And so like I'm trying to at least sort of tear down that wall just a little bit maybe of showing like, okay, there's a human side to everybody, whether it's,
Yeah.
you know,
Yeah.
muscular dystrophy or not. And I don't I don't like the conflict that comes out between different groups even. And it's
No, it's a
like,
very big divide, hey? It shouldn't
yeah,
be. Yeah.
yeah. And there's some really deeply rooted ableism obviously there, and like the more quote unquote normal somebody looks like, the less of a hard time they have with all the issues of access and advocacy and things. So I'm just like, if we can share even the smaller voices, like not the big social media like giants that have hundreds of thousands or millions of people, right? But like there's a lot of stories that need to be told that don't get out there, you know.
Absolutely. And I
Yeah.
feel like not only is it interesting for everyone else in the world to hear, can rather be healing for someone to come onto your podcast even and just like talk about it. And regardless who hears it or who doesn't, I'm sure it's healing for a lot of people,
Hmm.
and that's great that you're able to have a podcast where you can do that. That I find that's pretty special. And like
Yeah.
getting to hear a bit more about your story, it's like you went through where you almost lost a form of communication and you almost like lost your voice, and then
Mhm.
here you are now, and like yeah, you're still on the ventilator, for example, but you got
Yeah.
your voice back, and
Yeah.
look at what you created. That's huge.
And it's crazy how much it still sounds like my old voice too. Like that
Yeah.
was crazy to, you know, get that back. And I'm like, okay, well, I'm going to use it even more now because like I was
Yeah,
in graduate school doing scientific based research and things and like that obviously was communicating there, but I just feel like now I'm using a lot of those tools to, you know, be able to do the podcast and share the stories and like, like I think I get as much just from listening as a lot of the guests, hopefully, of talking, and sharing stuff.
absolutely. I enjoy listening to all the stories as well. Like it's just very eye-opening, and I find it curious personally as a nurse just because like I said, I can only have like a certain perspective of it because I don't live with this in an everyday life,
Hmm.
but I guess I come on shift and I see it and can at least feel some feelings of like what someone might be feeling and what a glimpse of what their life might be. And it really does make you sit there and reflect. And I'm sure there's other nurses that do it too, where health is a very important factor in life. And I truly think you don't have anything in life if you don't have your health. And
True.
unfortunately, a lot of people do take advantage of that
Yeah.
until
Yeah, they
something
do.
affects them, you know?
Yeah, yeah, and I mean, I'll be the first one to admit, like there were nurses that weren't good, or like my stigma towards the medical world or industry was like not good. And
Yeah,
I think that's a lot of patients. They go through these really traumatic things, and while it's probably deserved with a lot of nurses, and like the frustrations they're real. It's like, you still need to try to approach it like they're there to help you, and they're not all bad. Um, and I think patients are that way too. I think there's a lot of us that, are just insanely difficult to work with for a million reasons, but it's just like some of the stories that you and I have even shared about conflicts going on between, that and everything. It's just like, I think just that awareness factor of, because like I think we learn a lot more talking about each other's sort of different experience there. And
absolutely.
yeah, it's
And
been big.
absolutely. I want to say that just talking about conflict and things like that too, about the hospitals, definitely still a big problem. And I wish that we could almost find some sort of solution where, we all take it. Like I was telling you the other day, just talking to your patient, like they're actually human because I find that some times we don't have time. It's in and out, in and out. We've got 10 other things to do, and I have to do an assessment on you and find answers. And I just feel like it's almost probably dehumanizing to some patients because I feel
Mhm.
like you probably see so many faces. Not only one doctor, not only one nurse. We don't all work 24/7. So you always see different faces. You're not only seeing the same people all the time, you have to deal with a lot of personalities. And it's kind of on the other side too. Like us nurses, we always kind of like to joke, like, we can't pick our patients, but like our patients can't pick their nurses either. You know what I mean? So
Yep, yep.
it's kind of a good way of looking at it that way because I feel like as when you go to nursing school, they always teach you to like put your biases aside,
Mm.
and it's you're there to work. You signed up for a job to take care of someone, and so put your personal biases and your personal issues aside and focus on them. But that is much easier said than done sometimes with
Yeah.
the human side of life, you know?
And honestly,
So
that I think that's not always a bad thing. I don't know about your perspective, but like, just like small talk, even when you're in that
yeah,
kind of recovery setting, it's kind of nice. Um, and I mean, it helps build the trust factor when there's a little bit of personality there, like I think that feeds the stigma of, like patients are just a number and like the nurses are just like robot caregivers that are supposed to just know everything. Um,
yeah.
yeah, and something I really learned a lot from you about was you were saying like you would go from one shift where someone was, crashing out or dying or something, and all of a sudden you have to put it on the front for the next
Yep.
person, and I mean that's a whole, set of extreme trauma at times, I would imagine.
It can be. It's just a little frustrating, I find personally, because I come from like a very empathetic, caring perspective, and I feel like everyone, like I treat anyone that's my patient like they're my own family
Mhm.
because they're someone's family. So, I would want me or my family member to be taken care of properly. So why wouldn't I reciprocate that? So, um, I find it's very challenging because we don't always have that, unfortunately, in the
Yeah,
healthcare. And yeah, like I said, just sitting there and even just talking to you and being like, how has your day been today? You're in the hospital. How are you feeling? Like, let's just chat it up quick so we can like kind of just have an idea of how we are. And
yeah.
that takes 30 seconds out of your day.
And
So if
sometimes
anyone
like there's
says no,
the rare nurse that even plays music, like in the
yeah,
room.
like
Like just
anything, just nothing. And to me, it blows my mind that like it's so in and out. People don't put emotion all the time to it because to me, I'm like, what a boring day. What a boring 12-hour shift of just going in there being like, hi, I don't really know you. Let me just connect you to your IV. Okay, bye.
yeah,
Like,
yeah.
who wants that? It's so boring. It's like, okay, there's that nurse that I don't really know anything about, but it's like, if you at least make reports and then I come back to your room, it's like we can just chat. Like in Canada, it was
Mhm.
always hockey. I'd watch hockey with my patients. So like, I'd go and do my own things
Nice.
with my patients, and then I come back and like, where are we at? How's the score looking? Like, so
Yeah,
like you have good report like that, and then they're in a better mood. Like I said, the environment's already stressful enough where
yeah,
I feel like a calming environment is very healing, like we've discussed prior to as
yeah.
well. And
Well, and it might help you. Like it might help the nurses get through a lot of the struggles they're dealing with if they have a patient they can chat with or, drop some dark humor once you, kind of
absolutely.
establish that. Yeah.
And it just establishes like a good relationship, I find, where you're able to put your guard down, which is what we need because essentially, if something goes wrong with your care, and I mean like not wrong on our factor, like something's going wrong with physiologically with your body, then you have better rapport with a patient. And it's like if you're being, I don't know, not so chirpy like you normally are, I will
Yeah.
detect that. What's wrong? Okay, no, you're actually not feeling good today because this is not the normal you. So
That's
it's
such a
just like
good point.
yeah,
Yeah.
I just find it goes a long way. And I think that like within the years of working in the healthcare, that like understanding of things and initiating things to try and work on that like topic
Mhm.
has really helped me build a lot of trust very quick with my patients. And
Yeah,
like
that's
it benefited both sides very well.
and that's much better than like having that. I don't know if you all have it in Canada, but like the scale of like how we're doing today, right? There's like, I don't know, 5 or 10 faces or something, and it's like,
Yeah, we do have that as well.
yeah. So I'm just like, if instead the nurse came in and chatted about the day or like asked legitimate questions instead of like, how are we feeling on the scale of, sad face to smiley face or whatever.
Yeah, we have that for people that can't very communicate, but like we'll also go with a scale of like 1 to 10. I'm sure you guys do the same
Oh
thing.
yeah. And I mean like they have their place, but at the same time it's just like, you know, it doesn't make our experiences any better or like making that the extent of the interaction.
Yeah,
So,
exactly. And I
yeah.
feel like, yeah, it just builds better rapport. You feel more human, you know what I mean? And
Hmm.
if you're stuck, like, I wouldn't say stuck, if you're assigned with that nurse all day and like for the multiple days that she's there, so say she's there for 3, 4 shifts, then at least, like, I'm sure probably it brightens patients' day up to know that there's like a bubbly, happy person coming on. Because realistically, a lot of the time, I feel like you're in a room, but like, yeah, you're getting treatment, but a lot of it is just laying there because you're waiting for results.
Yeah.
You're waiting for tests. You're waiting for scans. So it's just a waiting game. And that
And
must
you're
be a
just
long day.
the day-to-day existence, becomes just for me it was so monotonous and boring. And so like every time one of the, nurses came in that I did kind of have a rapport with and they would ask some questions and we visit, it was just like that helps you keep going just a little bit more, I think. And
Absolutely.
yeah,
Yeah.
like it's yeah, if there's even a little bit of that is huge. So
Absolutely.
yeah, yeah,
Yeah. Are there like certain nurses in the COVID days that kind of like stuck with you or that
yeah.
yeah?
I mean, honestly, I feel like I worked with probably 30 to 40 nurses because it was COVID, it was the holidays, everybody
Yeah,
was in and out. But,
everywhere.
I got lucky enough. There were a few that came in and there was some relatability there and they would actually have some empathy and listen to what I was saying and
Yeah.
much more of a team-based approach to everything. And then there were ones that was like, try to like force something or try to I remember a doctor or nurse as I was leaving trying to pull out the pick line I had, and it was like, that's not the way you do it, and we need to, communicate better and get somebody else in here to help get this thing out, But it was the good ones, I think, helped make sure I got through.
Yeah, absolutely.
Yeah, despite some conflicts that went on, which were kind of rough, but yeah, the good ones made it worthwhile.
I'm glad to hear at least that like there's so like positives out of all the healthcare because I find in today's world too, like it's obviously human to just kind of focus on the negatives all the time,
Hmm.
especially when you're going through something difficult.
Hmm.
So I can't even imagine being on the other side of my job where you're the patient dealing with very difficult, like a difficult situation, whatever scenario that might be, and then to just not feel heard and have your nursing staff not really listen to you when you're just trying to reason with them saying, hey, I know my body, I've dealt with this my whole life. I'm not trying to
Like
like know any
undermine
better than
you
you. You
or
know what I mean? Yeah,
yeah.
exactly. And I'm just like, this is what works best for me. And usually when someone tells me that, I'm like, thank you. I will take that because you know what's best. But I find like, yeah, put your biases and differences aside because some people just are quite stubborn and they're like, don't tell me what to do. Some like kind of mentality.
And
And
that's the worst place to have that, it seems to me,
yeah, quite
like,
dangerous if you ask me. I've seen it
yeah,
unfortunately, but yeah, it's very unfortunate.
yeah. And I wish that I could say, like it was the majority that were good, but it was, maybe five nurses that I saw the whole time that were actually
Yeah.
caring enough, and would ask things and yeah, and it made all the difference,
Well, that's quite a low number. So I'm really hoping that, with time things improve. I think that another thing that I would touch on is just out on the nursing things. Just as an LPN, I've never been to school for an RN, but we didn't really talk
Mhm.
about those things all that much. I think that it would be very worthwhile to have like classes of being like, I don't know if you could call them classes on how to be empathetic. You can't, but like just learning about being a little bit more like emotionally intelligent, being able to like put yourself in someone else's shoes, put your biases aside, put your emotions aside, don't react and just respond. That's a very important one as a nurse because I feel like you can't respond in emotion because the patient is emotional enough with what's going on that they might
Mhm.
not think logically. So you have to be that logic for them at the time.
Right.
So yeah,
Right.
definitely a big one.
Yeah, that makes a lot of sense. Like it could be some kind of module maybe or something, or
Something.
and
Yeah.
I was actually that made me think of as far as like protocols of caring with people with different diseases or anything. I wonder at some point if there was something to say like this is what happens when you have, a general neuromuscular disease person. Like
Yeah.
you can't do X, Y, and Z on turning or positioning or transferring because I sustained a hairline hip fracture too because they weren't sure how to move me to get a CT scan, things like that. And so it's just a little communication would, or like training of some kind to be like,
Absolutely.
you can't always transfer somebody like anyone else,
Yeah,
But
absolutely. And I think that really factors in on that communication. Like but again, easier said than done because I
mhm.
find you're dealing with a lot of personalities, regardless if you're looking at it in the nursing perspective or the patient perspective. So it's just very difficult. And I can see how it might be discouraging if you've had some bad experiences in the past to speak up.
Yeah,
Um, but unfortunately, in the healthcare world that pardon me with my cat, um, with the world that we live in, I just find that we definitely need to come up with a better solution for sure because yeah, a lot is being missed. And like you said, if it's at the point where like you have like a hairline fracture of some sort, like think about how much longer recovery is, how much longer you have to stay, and how much more treatment that is just because of
mm,
something as simple of just communicating could
yeah,
have avoided all
yeah.
that.
And it
Yeah.
almost got to the point where it sometimes felt like they wanted me just to stay there. Like, I don't know, like as like a prisoner or something. That
Yeah,
way for
yeah,
a while. Yeah, yeah. But it's weird, and the ones that kind of know, the ones that act like they want you to get out, that's
yeah.
that helps. And it probably makes your job easier too. I mean, having patients that actually do share like, what works and what doesn't and that kind of thing.
Oh, absolutely. I say my patients and my patients' family are always the best resources I have because I could always look into a chart and see someone's history, some notes of the emergency visits they've had, but
Which can
that's
be a
also just
thousand pages probably sometimes.
exactly. But it's also the physician's perspective. So I also like to go in and be like, okay, so you went here for this visit. How did that go? Because it could be a whole different perspective on like the patient's outlook on how that visit
Hmm.
went versus what the doctor wrote. And then you're like, okay, this wasn't such a good visit. You didn't have a good experience. So let's kind of like break it down and see how we can like make this a little bit better for you. So yeah, that's a
Yeah.
big factor too.
Yeah. I mean, it's little things, right? Like it's that can make so much of a difference.
Yeah, I know
Yeah.
it's where do you start, unfortunately? I guess just to talk about it and
I
acknowledge it.
know. I know. Yeah. And I mean, like it's not going to solve everything at once, but I feel like at least, you know, I think sharing these kind of conversations outside of a stressful hospital environment
Yeah,
would really help people.
absolutely. It's like I don't know how your viewers feel. Like I'm sure we were all really intrigued and happy to kind of hear a little bit more about your own personal story. But it'd be
Mhm.
interesting to hear what people think on if they'd want to maybe get a few more perspective from other healthcare workers, maybe get
Mhm.
like the perspective of a physician of some sorts or some, kind of just those perspectives as
Yeah.
well. I'd be kind of curious
Yeah.
to see the opinion with you on that.
I know. And like even
Yeah.
some of the surgeons maybe, or like even like
Yeah.
well, I have visited with a few OTs and PTs, but it just seems like there's not enough. Like you can just keep doing more and more, I think, to bring, those
Yeah.
perspectives through because it's easy to be like, I'm going to divide myself away from the healthcare workers and everything, like, make kind of that black and white conflict. And it's not going to help anybody, and
No, I feel like it's definitely a gray zone and
yeah.
we do have to talk to just almost like reconcile. You know what I mean? Because I feel
Hmm.
like having these conversations, maybe I wasn't the nurse in one of your traumatic scenario, but talking about it and acknowledging that there's other people out there that might totally understand where you're coming from on the nursing perspective or the healthcare perspective. I mean, I feel like that hopefully kind of makes you feel like it can bring us a little bit closer in that sense. Just
Yeah.
where hopefully, like, I don't want to use the word hope, but like it's hopeful for your next visits where you're like, okay, like it's not all that bad. Like
Yeah.
maybe like the maybe my next nurse who's going to help
Hmm.
me is going to have a wonderful perspective on life or I'll feel heard or
Yeah. Yeah.
something
And
like
odds
that.
are like, I'm gonna need some kind of health care assistance or help, in a doctor's
Yeah,
or hospital environment, and so like trying to remember to go in and like, try to communicate everything you can to your nursing and, try to make it,
yeah,
better for the next round, and like not to say that I want to end up back in ICU or back in the
no.
emergency room or
No, who
whatever.
wants to, honestly?
Yeah, yeah, but
Yes.
it's, I think overall it's beneficial to try to, keep these things in mind and like to understand, you know, from a lot of things we share back and forth, like what the other kind of needs because I mean, we have a lot of shared experience, and it's different perspective, but it's still both are valid, I think.
Absolutely. And it's kind of nice to hear both kind
Yeah.
of all together because yeah, it's totally valid. It's totally um like we kind of commingle because you're on one side of things, I'm on the other, but we're all in the same environment and we're all
Hmm.
there focusing on, the patient that's there. So
Yeah. Yeah.
it's yeah, it's definitely something to talk about and just I don't know, I hope if there's any like healthcare workers that are listening as well, they just kind of sit back and reflect and think like, okay, like listening to all these new perspectives, maybe like how could I better my own care and just
Mhm.
like little ways in my everyday. Because I always feel too personally when I give my best care, I feel so much better going home. I
Yeah.
don't. But another thing, like just from the last episode we had, as a healthcare workers, recognizing burnout is a big one too. Because I find if you are burnt out, you don't have empathy. Therefore, I don't think that you can really perform the best at your
Mhm.
job. Because as a healthcare worker, I feel like empathy is a huge one and a huge factor and a huge role in our care, like in our job, in every
Yeah.
day.
Yeah. I can't imagine. I mean, even, like depending on where you're working, like that stress and burnout that you have in caregiving is just such an extreme thing to
And it's
put
just
things
like
in.
recognizing that and voicing it and just acknowledging it and saying, hey, it's okay that I'm burnt out and I don't care for the patients like I used to. What's the solution? like that's why I say switch units, switch different like profession,
Hmm.
if you will, in nursing. There's such a diverse area that whenever I felt like I was somewhere for too long, I recognized that. I moved on to another unit and it was like empathy all the way up here just because it's a new outlook, it's new patients, it's a new pace, it's a new environment. So um
Yeah.
keep yourself challenged. It's important to do that, I find. And I
Yeah.
at least for myself in my experience that really helped with the burnout.
Oh, totally. And like my own experience with burnout being in academia space,
Yeah.
trying to do all the things required there, like
Yeah.
I agree with you. Like, sometimes you have to take a shift in direction or a break or something because that burnout cycle, it's not going to end in a good place usually. And so like, it takes a lot to pull back and realize, you know,
Yeah.
like I'm not able to do what I need to do, so I have to move. But
Yeah,
yeah, it's a
that
good
and like
point.
even talking about it because I find a lot of people bottle things up, and let's be honest, that never works.
No, it is not.
It's good to talk about.
I'm not sure we can name one time when that actually worked.
Yeah, right? Yeah, no, and it's silly how people are just so against talking still. But personally, I find like it's just very difficult and still kind of a stigma to not
No
talk
kidding.
mental health. So,
And like you
uh,
get you get the social media comments, from like, I don't know, the profiles that don't have a picture, right? Or like just random
right,
people
yeah,
sitting behind their computer looking for trouble. It's like, well,
yeah, the keyboard warriors.
yeah, that's gonna fix things, right?
Yeah, like it's
Like,
silly.
yeah,
There's
like,
always, yeah,
yeah, and there's always gonna be that, but I just feel like, there's some voices out there like ours, I think that can kind of fight against it, make it better.
absolutely, and kind of advocate for what's right, if
That
you
too.
ask me, right?
Yeah. Yep. Exactly.
Absolutely.
Yeah.